thank you so much for following my reels and for being a part of my social media platforms. You have asked many questions, and so I have put together this presentation for my social media users. It's a very short explanation about who I am, what I do, and how I approach brain health. So let's not delay, let's get right into it. First of all, I want you to know my story. I graduated from BYU as a nurse, and I went straight to work in an intensive care unit. After working ICU for a couple of years, I thought, I'm gonna go to graduate school and actually prescribe and diagnose and treat patients. So I finished my master's degree at Idaho State University. While going to school, I worked as the program director for a geriatric nursing home and specifically a psychiatric center. So individuals who struggled with terrible dementia. And at the same time, I partnered with the local physicians and purchased an urgent care called Physicians Immediate Care. Still functional in southeastern Idaho. I'm still the chief operating officer of that clinic, and I employ full-time medical staff personnel to staff that clinic. Over the years, I've done weight loss. I've done consulting at the local VA home and at Bingham Memorial Hospital. About 10 years of my practice solid has been a lot of geriatric care. I expanded into primary care and mental health. I did a joint venture with Mountain View Hospital. To this day, I'm on their medical staff and oversee a couple of the clinics here in southeastern Idaho, and also joined forces with Eric Collette at A Mind for All Seasons, specifically so I could take this functional medicine component to individuals who are looking for an opportunity to improve their brain health. I am the author of the Enhanced Protocol and also a psychotropic drug review protocol for individuals in skilled nursing or assisted living center where we're trying to avoid the use of psychiatric medications to treat them. All along, I've been fascinated with Alzheimer's disease and how to prevent Alzheimer's or Parkinson's and other forms of neurodegenerative diseases. And I've done training at Alzheimer's Universe and looked at their protocols. This is an example of the protocol that Richard Isaacson, he's the medical director at Cornell, that he developed to try to prevent Alzheimer's disease. And you can tell by these graphics, this is complex medicine. This is an example of his algorithm of how he ties everything together. Well, most of our patients can't do that. But if I simplify it and tell them, hey, here's some of the supplements that are involved in the algorithms to manage your health, many of our seniors can do that. And if I walk them through a step-by-step program, I've been able to make it easier. I've also followed the work extensively of Dr. Del Bredesen. He's the author of the RECODE protocol, very well-established neurologist in conventional medicine, wrote a protocol to try to help individuals avoid Alzheimer's disease. And Del is notorious for saying, if you wanted to produce a drug that beat Alzheimer's disease, it would have to do these 50 things. Well, there is no drug that does that, so you have to simplify it. Most of my patients don't even know what those things are. So I'd like to compare Alzheimer's disease like a boat that has a hole or 2 or 3 or 10 holes, and there's no way that that boat's going to get in the water. But if you start patching holes and plugging holes and fixing the barrier, there's a chance that we could make that thing float again. That's the analogy that we use in Alzheimer's disease. Well, Dr. Bredesen published his first paper in 2015. This is really what set me on fire. One of the local pharmacists came to me and said, Randy, a doctor out of UCLA has reversed Alzheimer's and he practices medicine just like you. And I thought, well, that's interesting. I wonder how I practice medicine because I haven't seen that. Well, as I started paying close attention, I saw the benefits that could come. Dr. Bredesen released another study a couple of years later. This is 2018. 100 individuals that were able to reverse neurodegenerative disease, or at least reverse the symptoms of those diseases. And now we're about 10 years after he started treating his first patient, and it has stuck. This is not something that you just do for a month or two and then it goes away. You have to work at this. You have to continue to charge forward. And there's been a lot of studies that have come hereafter. So let me just explain to you my approach. Generally speaking, everyone that's joined my social media is searching for a better solution. And they often find A Mind for All Seasons as the vehicle to help them accomplish their goals. Well, when they do that, my goal is I've got to gather more history about you. I have to gather this really broad, brain-based history so I know where's your potential deficit, where are the holes in the base of that boat. From there, We start looking at triggers. Did you have a motor vehicle accident? Are you experiencing chronic fatigue? Have you been diagnosed with attention deficit disorder or had multiple concussions? All of these things are brain linked. And the more I know, the more I'm able to help you make a difference in your life. I always do baseline assessments. And most of my remote clients, people like you who live outside of Idaho and a long ways away, I've highlighted that one in red called a CNS-VS. That stands for Central Nervous System Vital Signs. It's a computer-based test that you would do to tell me your baseline. Now, you've spent your whole life getting preventive testing. You've done cholesterol testing and gotten wellness visits, and you've gotten mammograms and pap smears if you're female or osteoporosis scans. When's the last time you actually tested your brain or you did some scan to see how healthy your brain is? I need to do that up front so I know a baseline and I know a measuring stick against which we can remeasure. So after you've participated for a couple of months, we retake that testing so that you can see how remarkable your improvements are. And then we set some goals. Maybe the goal is I want to stop the decline. Maybe the goal is I want to become more social because I'm losing my ability to speak and I feel really self-conscious. In the end, we want to prevent the loss of independence and help you find improvement. And I think we can do those things depending on how early we start and how good we are at identifying your personal risk factors. So in my protocol, it's called the Enhanced Protocol. There are phases, and there are many of these phases where you don't necessarily need me or need a coach, but there are some phases you might. Phase 1 would be stimulation therapies, things that stimulate the brain. And I don't have time to go into those, but there's a lot of things that you can do at home. There's a lot of things that we do at our clinic or we can do remotely that work as brain stimulation. Think of your brain like a bicep. If you work hard to strengthen that bicep, it ends up getting stronger and gets better. And our goal with stimulation therapies are we want to increase circulation into the brain, improve blood flow to the brain, and improve mitochondria. And I won't get into what that means, but it's basically how you power your brain. From there, I work with all of my clients on lifestyle improvements. So just quickly going through these, we've got to make sure that you're sleeping good and that you've got good nutrition. Everyone needs to be engaged in an exercise routine and minimize stress. Alcohol is not your friend. In the long run, it's going to hurt you. We want to make sure we look at your dental health. And then my business partner, Eric Collette, is a master at looking at vital 5 pillars. This is kind of some behavioral training. So these are all things that we do while we're doing repeat cognitive testing to see if we can make a difference. Well, then we get into phase 2, where after you've really embraced some of the lifestyle interventions, we've got to do a broad panel of laboratory tests. This is something we really can't get around. We've got to do this. And I've worked out a method where I can do laboratory testing for you in a distant city and get those results sent to an electronic dashboard. So I can order all the lab testing that you need. And from there, I start working off acute medical support issues and focusing on circulatory support to the brain. I'm looking at all of your micronutrient levels because we can't improve brain health if there's no micronutrients that are getting to the brain. We're going to work on oxidative stress. Many of our clients don't even know what that is, but there's things that you can do to lower oxidative stress and support neurotransmitters. Finally, we've got to avoid microglia priming. That's a principle in the brain where the brain gets upset and it has a hard time settling down. That's very important. And oftentimes I have to work hard at helping some of our clients recognize symptoms of microglia priming and then addressing them. From there, we move on to the next phase, and I call this transitional medicine. A lot of people, specifically doctors, will say, well, there hasn't been a study in Alzheimer's on the use of hormone replacement. No, that's true. We don't know if hormone replacement actually optimizes neurological health, but I can tell you them visiting with hundreds of women and managing their menopausal symptoms, they all do better. So I call this translational medicine. If an intervention helps one group of people that might have some sort of neurological disorder, would it translate and help another group of people? Translational medicine includes things like nutraceuticals, which I'm a huge fan of and have had extensive training in nutraceuticals, hormone optimization therapies, or fixing leaky gut, toxins and how they affect the brain, autoimmune diseases. Most people don't know what neuroautoimmunity is, but a lot of people have symptoms of neuroautoimmunity but have never actually received the diagnosis. We can find that in testing. We also will look at molds. Have you been exposed to mold or to Lyme or tick-borne illnesses? And then once again, we continue to repeat our cognitive testing to make sure that we're making a difference in your life. So in summary, the enhanced protocol looks at very intentional lifestyle interventions, followed by very extensive laboratory testing and addressing each of the personalized medical needs for an individual. And then it's followed by a translational medicine component. I don't do this for everybody, but I do this where it might apply based on our discussion and our working together. So now that you know that, you might think, dude, this is complex. This is too difficult for me. Well, that's my job. I've got a system that really simplifies that, and I take it step by step. I'm not kidding when I say on my social media reels that you can't fix neurological risk with one intervention. It has to be personalized. It has to be precision medicine. And I've become very good at doing that. I've helped hundreds, even thousands of patients manage that. So here's how you access me if you want. This is a look at my webpage, right at here. It's a mindforallseasons.com. When you click on that webpage, if you want to learn specifically about this process that I've just explained, it's called the Enhanced Protocol, and you can click on that link. And I want you to put in your email address so you can get my newsletter. Maybe you're not quite ready to do something, but you just want to vet me a little bit more and learn. Join my newsletter, and I'll communicate with you every month about some of the things that I'm doing. If you're the type of person that believes in a personal touch and you want to talk to somebody, well, just go to the page that says contact us, and you'll get to this page. You'll see that picture there. That's my business partner, Eric Collette. And then from there, you can fill out this little summary and leave a typed message about what you want. A member of my team, one of our coaches, will receive that message and will reach out to you personally. Now, when we call you, you won't have our telephone number listed. So I've listed that telephone number right there. You can watch for it. But if you don't have my telephone number, you're likely going to have to listen to your voicemails or clear your voicemail so I can communicate with you. Finally, don't let anyone tell you that if you're trending towards dementia, or if your mom or dad had dementia and they had to go into a nursing home, or you've had a head injury, or you played in the NFL, don't let anyone tell you that you can't make a difference, because there's a million things that you can do. I work with many football players. Here's one of my favorites right here. He's become a very, very good friend. He joined our protocol well over a year ago. Let's help you. If you have a problem and something I have said today has resonated with you, go to my website, look us up, reach out to us, and let's see if I can help you establish a better brain.